Some funding is provided by John A. Cook, Certified Public Accountant at 105 East Main Street in Westfield.
The Chautauqua Integrated Delivery System. Our community of doctors is pleased to announce their affiliation with Senior Choice. Senior Choice fills in where your Medicare coverage leaves off.
Fairpoint Communications, formerly C&E Telephone, providing telephone, internet, and data services, is proud to fund this broadcast of Senior Report.
Some funding is provided by State Senator Catherine M. Young.
Absolute Care of Westfield, committed to returning the favor to those who have spent a lifetime caring for others. Located on 26 Cass Street in Westfield, New York.
Some funding is provided by the Lakeview Hotel and Restaurant, located on Water Street near the lake in Mayville.
Live from the Chuck Kelsey Television Studio at Access Channel 5 in Mayville, it's Senior Report with Reed Powers. Call in and participate in Chautauqua County's only live call-in senior program. Share a thought or wish someone a happy birthday. Saturday mornings between 9 and 10 a.m. And now, here's Reed Powers.
And good morning. What a beautiful, beautiful day it is here in Chautauqua County. Wow, the sun is beaming now. What weather we've had. And it's been, our gardens have been nicely watered every day. We've had a lot of water. God bless the people over in Silver Creek. They're still digging out. And in Gowanda, unfortunately, they had an awful deluge too, and it seems that it's created quite a hardship, especially in Silver Creek, where they did lose a lot of buildings, and it was just devastating. Hopefully we're giving them aid and succor. All the fire departments around here are helping them out. I know that. One of the important things the fire department has to do is to hose down the roads. You know, the roads are covered with that much mud, and you can't get through. So they go over those big powerful hoses on the engines and hose them down. And also helping people get it together and get their belongings. It's just a shambles. And I want to say this much: the people in this area are very vital and hardworking, and we all pitch in and help each other. And I hope that continues, especially in Silver Creek and Gowanda and any other areas that have been devastated by this terrible flooding we've had recently. We have a lot of stuff going on over at the on the tube, of course. The national news is somewhat alarming. Apparently the special break you got for turning in the clunker thing is finished because for two reasons. One is the government ain't paying. They haven't paid 1% of the people that have taken the clunkers in and paid for them essentially, and supposedly are going to be remunerated by the government out of this billions and billions, I don't know, it's 3-5 billion or something that was put up for it, but they're not getting paid, and they don't know if they're going to get their money back because they got to approve each clunker, and it looks like they're about as far behind as they are with the Veterans Administration. You know, the VA is about 500,000 cases behind of wounded veterans who've been hurt and shattered and broken and smashed and torn apart in our little wars we keep running over in Iraq and in Afghanistan. And when they come back home, they need medical help, they need food stamps, they need all kinds of things, income. The government ain't doing it because they can't process their claims. So these poor people are sitting around in bed wondering, when am I going to get help? It's about time they got their stuff together with the Veterans Administration to take care of our brave heroes, as they say, who are in the war and getting injured. And this is a national crime, for God's sake. I think everybody should get after the Veterans Administration, say, you guys hire a couple more people or something and get your action together. And incidentally, they just approved $25 million in bonuses for the people working at the Veterans Administration who can't process our wounded soldiers and their families and their children. There's something wrong here. And of course the war goes on and on and on, and Obama's sent a whole bunch of new troops over to Afghanistan to heat that one up, and we're getting killed right and left all over the place and spending trillions of dollars of our money for this. For what? My answer is to say to them, you got 30 days and then we're pulling every man, woman, and child out of here. Because it's futile. All we got is a bunch of corrupt governments over there, and nothing's really being done. We're doing all the work and paying all the bills. And it's going to get us nowhere. The minute we leave anyway, whether it's 20 years from now or tomorrow, they will have a big shoot down and the people in charge will be in charge again. Very simple. That's the way it's been for 10,000 years in these countries. It's bankrupted 3 countries trying to take them over, and it looks like it's going for the 4th one now, the United States. Health care. That's in the news all the time because you got a bunch of, well, the health insurance companies, all 1,400, 1,600 of them or whatever, stand to lose $1 trillion, hundreds of billions of dollars, if we have a public health care program, because the insurance companies are creaming off about 1/3 of the profits for their own profits. The government isn't going to be making a profit. And they run on about, instead of 30% overhead, about a 5% overhead, which they're running on now with Medicare. I think the people are well paid by the insurance companies and the insurance companies who are running night and day huge ads telling us how horrible a public option is and how socialistic it would be, although we do have half America's, a good percentage of America is already on socialized medicine anyway, between the Veterans Administration, between the Medicare and between Medicaid and Child's. There are state programs too. A great number of people already on it, and we have Social Security, which is a federal socialized program too. You want to do away with that too. Doesn't wash, guys. They're just trying to stop it. They're scaring everybody. And the idea that the program has a hidden agenda to do away with seniors is preposterous. They want us to think they're rounding up, so they'll be rounding up seniors, taking them off to extermination camps. Give me a break, letting them die. Well, if they did, it would save half our health care costs, naturally. Not on a bet, guys. That's the stupidest thing I've ever heard. But it's a panicky thing they send out. They're sending out these messages, these lies, and that's going to bankrupt America and all this crap. I'll tell you something. Somebody called into the program last week and said, well, you know, who's going to pay all this taxes? I said, well, first of all, sir, do you realize that family health care costs $12,000 under the current program, and they're raising it every year, huge percentages. So that's a little hidden tax, fella, because your employer pays it, or you pay it, or somebody pays it. Yeah, 12 grand is the average cost for a family health insurance policy, a good one, that does cover everything, that doesn't stop at $10,000 or something. Some of these fake insurance programs do, you know. They say, oh, we give you health insurance, full coverage. But it expires after $10,000, which is basically a visit to the hospital sometimes on an emergency basis. Yeah. 50%, half of all bankruptcies in this country are based on health care. The health care system has bankrupted half of the people who go bankrupt. Yeah. And 3/4 of them had health insurance, quote. Yeah, think of it, put that in your pipe and smoke it. We need a public option. The entire world has it, excepting for us. And much as they try to scare us to death, when they last polled the Canadians, 96% of the Canadians were very happy with their program. And they don't have to wait forever for urgent